Good morning everyone and welcome to today's webinar, Preparing for Your Neurologist Appointment. Your presenter today is Jane Bridgman and my name is Annie Sasson and I'm your facilitator. We begin all our programs with an acknowledgement. We acknowledge and pay respect to the traditional custodians past and present on whose lands we meet today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. Okay, I'd like to introduce you now to Jane. So Jane is a registered nurse with 6 years experience in the disability and aged care sector, and also in the progressive neurological conditions and primary healthcare sectors as well. Jane is also an internationally certified MS nurse and works as the MS Nurse Advisor here at MS Connect. The MS Nurse Advisor service is available for clients, carers, family members and health professionals who have queries about multiple sclerosis, the symptoms, medications and general wellbeing. If you'd like to speak to an MS Nurse Advisor, appointments are available by phone, Skype and by FaceTime. So I'll now just put on the webcam so you can say hi to Jane and you can see that she is a real person. So just bear with us a moment while I click a few buttons. And it should come on very shortly. And there's Jane now.
Hello.
Hi Jane, welcome.
Thank you.
It's nice to have you with us today.
Thank you, Annie.
No problemo. Okay, I'll switch that off now and I'll hand over to Jane to begin the webinar for us. Over to you, Jane. Thank you.
Thank you, Annie, and hello to everybody listening. So you may be someone who is newly diagnosed and has had 1 or 2 appointments with their neurologist, or you may be someone who has been diagnosed for a while and you've had numerous appointments with your neurologist. It doesn't matter which category of those you fit into because this video will be beneficial for you. We're going to discuss some ways that you can prepare for your specialist appointments to get the most out of your relationship with your doctor. So we're going to have a look at these objectives. Why make the effort to prepare? Things to consider when preparing, the obvious and less obvious questions, common symptoms that may be unrepresented by MS patients when talking with their neurologists, and common problems that lead to poorer outcomes or experiences at appointments. So having a look at preparing, there's obviously a little bit to do here. Your appointments with your neurologist may be few and far between, and they do have so much to offer, but there is so little time. So we need to think about, what do we need from the appointment? What can we do to plan ahead? And by doing both of those things, we can actually get a better outcome from the appointment, which can help us live better with MS. Each neurologist is different, and it is important, if we can, for you to find a doctor who you respect, who you feel comfortable with, and who you're able to communicate and work alongside with, because it is really a bit of a team-based relationship. It's not always as easy as it sounds to do that though, and especially for those people living in the country and regional areas, I do understand that there certainly are very limited options for MS specialist neurologists. So don't forget that your GP can also answer some questions about your symptoms, and that the relationship we need to have with our neurologist is a bit of a two-way street. So we need to take responsibility as well in making the appointment work. So being prepared, this is what I've called the logistics. A referral, you might not be aware that the first referral you receive from a GP to the neurologist usually lasts around 12 months. But if the referral was made by another specialist, it may only last around 3 months. If you arrive at your appointment without a valid referral, you may actually be denied the Medicare rebate. And then an ongoing referral can be made, which is called an indefinite referral. So that's kind of one that is open-ended and can provide ongoing coverage. So that's a really good thing to be aware of. It's also good to bring a support person if you can. And that's not just if you need, mobility assistance, but more so with the emotional support and communication. It's great to have someone there with you to help you stay on track, I suppose, with the conversation, to bring anything up that you may have forgotten to discuss, and also someone that you can talk to after the appointment and say, oh, what did the neurologist say about this? It's good to have someone there with you. We want to make sure that any routine tests are completed well in advance so that the specialist has time to review the results prior to your appointment. So many of you may already be in the routine of having MRIs done a few weeks before your next neurologist review, and that's so that the neurologist has that report and it's all ready to go, so that when you have that appointment they can actually review those results. And it may also include results from recent blood tests or other things that you might like the doctor to be aware of. So do have a think about that. Think about if you need any transport, whether you'll be driving yourself. Parking is a big thing. Often hospitals and medical clinics have very poor parking, so make sure that you've got coins if you need to use the parking meters, and allow plenty of extra time for parking. If someone's going to drive you, make sure that's all confirmed as well. And if you do need an interpreter, then make sure that that's arranged ahead of time, because they can be pre-booked. Cost is another one, and for some people there might not be cost for the appointment if you're going to a bulk billing clinic or you're going to the hospital, for example, but there may be other costs. Like I said, for the parking, you might not carry cash. I never carry coins on me, so it is a good thing to pre-think of if you need to carry coins for parking. Also, if there's going to be any medications that you're going to want to kind of get on the way home, it's good to budget for that. And if you are seeing a private neurologist, you can call and ask what the cost may be ahead of time, just so that you've budgeted for that. A list of medications. You should take a list of medications that you are taking, and that should include any herbal medications, any over-the-counter medications, or non-prescription medications, as they can interfere sometimes, and we do want the neurologist to be aware of everything. And also time. How long should we allow for the appointment? So we often can get there on time, but then the appointments can run over time. So if you're not familiar with the clinic or the doctor you're seeing, you might like to give them a call a few weeks ahead of time just to find out. And if they say, oh, look, we usually do run a few hours behind, it probably doesn't mean you won't get there on time, but you might bring a book and a snack and just be comfortable to sit and wait, and not be surprised, because it's awful if you've got somewhere you have to be in a hurry, but you don't want to miss your appointment. So being prepared with the communication. Plan your questions and write them down. And it's really good to do this, especially anytime you have a thought kind of in that 6 months or 12 months during the year when you're in between appointments. Write down any queries that you have, and you can always narrow them down later. You could write them down on an old school pen and paper. You might use the notes section on your phone. If you have a smartphone, you might email your questions, and depending on the neurologist, or if you have an MS nurse, you might be able to email your questions ahead of time, or you might be able to use a voice recorder or a voice memo app on your smartphone. So any way to write them down. We do have a checklist kind of template, but there are a number of different options for you to get those things written down. Now, preparing the talking points. This is a good one. So we've just covered this about using the checklist, using the notes app, and using a variety of methods to get those questions documented. And if you have a partner or close family or a GP, you might also like to ask them if they have any questions that you might like to consider adding in there as well. So these are some of what I've called the obvious questions and discussion points. So it's a good thing to ask about reviewing any test results. If you've had any relapses or concerns about relapses between appointments, any treatment recommendations. So not just about how things are going with the drug that you're on, but is there anything else, doctor, that maybe we could do? Prescriptions. That's often something we forget to ask about. So is there any medications that you need new prescriptions for? The neurologist can do that in the appointment. Any new symptoms, something that's come up, either that's still with you or that perhaps came up and lasted for a week and then went away. Symptom management is a big one. It's a really good idea if you can have a bit of a list of your symptoms and just keep that list going. Every time you get a new symptom, write it down. If it leaves, cross it out. And then every time you have an appointment with the neurologist, you can just touch base on that and say, okay, so you know that I do have a bit of muscle spasm from time to time. Is there any other ways we can treat that? Is there anything new available? Shall we change the dose or shall we change the medication? So if you have an unresolved symptom, continue bringing that up politely, just at every appointment, because there's often something more we can try, and so it's worth mentioning that to the doctor. Disease modifying therapy, that's the big one. So we currently only have medications on the PBS for relapsing remitting MS, but we know that something for secondary progressive MS has just recently been approved by the TGA, and we hope that some different drugs might be available for other types of MS soon as well. So do have that conversation, because there are often new drugs that are becoming available every couple of years. But also the drug you're on might need a review. Maybe you've been on it for a number of years and had a number of relapses. Major life changes, that's also a good one. So if you've had any big things going on, or perhaps if you're planning something, so if you're planning a pregnancy or perhaps an overseas holiday, that's a good time to have a chat with the neurologist about those kinds of things. And then also any requesting support letters or documentation, such as if you need something for a driving assessment or the NDIS or even a disability support pension. So we're going to have a look at some of the less obvious questions now. What kind of things do you want me to inform you about between appointments? I think this is a really good one, because it helps us understand what the doctor expects of us. And that way, you know, something pops up, oh, the neurologist actually wants me to tell them about that, or, oh, they said not to bother about that one. I can take that concern to my GP. How would you like me to contact you between appointments? Some doctors prefer a phone call to the clinic. A private neurologist might give out a mobile number. It could be an email, for example. So that's a good thing to find out as well. When might I expect return contact from you or your team? That's a really important one. So if the neurologist says, look, give me a call and leave a message with my receptionist and I'll usually get back to you within a week, then you know if it's been 4 or 5 days, it's not necessarily that the doctor hasn't gotten the message or has forgotten you. It's just that it might take them a little bit of time. But vice versa, if the doctor says, oh, I usually will contact you within 24 hours, and you've left a message and haven't heard back after 2 days, then you know it's time to escalate that inquiry. If you are unavailable, so if the neurologist is unavailable, such as on leave or it's a public holiday, etc., is there a preferred other doctor to contact? This is the big one, especially if you see a neurologist that might work in a sole practice or perhaps a small MS clinic where there's only one doctor, because there are times when that happens. A neurologist might be on maternity leave or at an overseas conference, or it could be the summer holidays, you know, Christmas or Boxing Day. So it's a good question to ask, again, so that you always know who to direct your concerns to between appointments. What should I do if I think I'm having a relapse? This is a really good one as well, because again, it's going to arm you with the information so that if this happens, you know exactly what you're supposed to do and that you're meeting the request of the neurologist, who usually do want to know about these kinds of things as well. If I need to go to an emergency department for something MS related, do you have a preference of hospitals? Now, this might not be appropriate for everybody, especially if you're in a regional area, but if you have a local hospital around the corner, but you actually travel maybe 20 or 30 minutes to go to an MS clinic at a big tertiary hospital, it might be easier for you if you think you're having a relapse, if it's possible to go to that hospital where your neurologist works and where the MS clinic is. So unless it's a medical emergency, that might be quite beneficial because they're already going to have all of your notes on file, and if you need to be admitted or if you need IV steroids, it's all kind of in the same family. So that's a good question to ask, but I must say that this is not for an emergency situation. So if you're having, chest pain or shortness of breath, that's not the kind of thing I'm talking about. It's more about perhaps if you have a relapse or have something to do with your MS, that's not necessarily a medical emergency. Which symptoms or situations should I speak to my GP about? So when is it that I should just go to my GP first and have a chat? And when is it that you want me to come straight to you and you would prefer my GP isn't consulted on those kinds of things? Are there any vaccinations I should be having? This is a good one as well, especially if you've got any travel plans coming up, such as international travel, because there's often different vaccines that would be recommended. There's also the annual flu vaccine, and for some people, even the shingles vaccine might be recommended. So a very good question to ask the neurologist, because some vaccines may be not recommended if you're on immunotherapy. So it's a really good thing to check with the neurologist about. Regarding general health monitoring, should I do anything extra with my GP? So when I'm talking about general health monitoring, I'm talking about whether it's a breast check or a pap smear, prostate exam, blood pressures checked, having blood tests to check your cholesterol levels, all these kinds of things, even a full body skin check. So often our neurologist might think that we're doing those things with the GP, but we might not be very stringent in getting that done. Perhaps the GP thinks the neurologist is organising a few of these things. So we don't want those things to be forgotten. So it's often very important just to check with the neurologist. Do they have any special requests for general health monitoring? Do they want you to have a flu vaccine every single year without fail, for example? Or is it very important that you have a full body skin check for any skin cancers? Not just pointing out a spot of concern to the GP, but having your full body checked. So they're really good questions to ask as well, just so that we're on top of anything that might crop up. I've still got this symptom. Is there anything else we can try? I touched on this beforehand, but I very much want you to know that just because a symptom is common in MS, it doesn't mean that we expect you to live with it all the time. So do just continue mentioning things like, yep, I know we've tried X, Y, and Z for my difficulties with sleeping, but I'm still not sleeping well. What else can we do? What other avenues haven't we explored yet? I'm planning a pregnancy or an overseas holiday or something else major. Is there anything we need to consider regarding this? So again, it's just letting the neurologist be aware of what's coming up so that if they have anything they need you to consider, they can let you know. And here's just a list of those questions I read through so that you've got them in your notes as well. Now, this is what we want to remember to raise. There are numerous studies that tell us about symptoms that are underrepresented, so symptoms that people experience that really have a negative effect on their quality of life, but for whatever reason, either the patient doesn't bring them up in conversation or the neurologist doesn't ask, which means that we can't help you and they can't be treated or improved. So please don't be afraid to speak openly about how you are feeling, in particularly regarding your mood. And depression and anxiety are words that should be used with honesty. And there is a difference between being depressed and having depression and being anxious and having anxiety, but it's okay just to use any words that you can find to describe how you might be feeling. And your neurologist does want to know how you are feeling. So don't keep this discussion for friends or private to yourself. Do raise that with the neurologist. It's okay, and it is important for you to discuss anything of concern to you. So don't be afraid to speak openly about your mood, and the same goes for bladder and bowel changes or continence changes and sexual dysfunction. Sexual dysfunction can be very common. up to 70% of people with MS can experience changes to sexual function and interactions, but it's very rarely discussed in appointments. So please feel safe to bring that up with your doctor, and if they're not necessarily the best ones to address the symptom or concern, they should be able to definitely let you know of who that practitioner may be, make a referral onwards, or have a chat with you about some other options. And you're always welcome to give us a call here and have a chat with me over the phone. Sometimes it's a bit easier to have those conversations over the phone if you're not looking at someone face to face. So please feel comfortable to speak to the doctor about it. But if that's still a bit much for you, you're more than welcome to give us a call and we can have a confidential conversation about that as well. So some common issues, some things that might not go to plan. Maybe we didn't have the scans or tests done in enough time for the neurologist to review, which means that they can't really let you know how things are going. So that's a really important thing that we do. And also sometimes it's worth checking, will the results go directly to the neurologist, or do you need to bring a copy with you? Perhaps we didn't write down the time and date and place for our next appointment, so it's good to know when your next appointment should be. There can be a logistics fail. We might have a referral that's expired. We may not have requested an interpreter. We might not have organised our transport, or perhaps we requested someone to come and pick us up at 4 o'clock, but the clinic was running overtime, so we weren't seen until 5 o'clock. Remember all your questions when you're on the way home from your appointment. I don't know if this has ever happened to you, but you think, yes, I'll ask this question, and then you're in the car on the way home and you think, oh my goodness, I forgot to ask them about brain fog. So I've missed that opportunity. And it's really common that we would say, oh, I forgot what the doctor said about this. So not only shall we get benefit from preparing for the appointment with our questions, but write down the answers. And if you're not able to write it down that quickly, perhaps the doctor might be comfortable if you ask them if you could record the audio of the conversation, or perhaps the neurologist can make some notes for you and write a few things down that they said. So don't be afraid to ask them to clarify something or give you some information on it for you to have a look at afterwards. Most of these issues can be prevented by being prepared. So have a look at our website and print off our checklist, or use any other method to get all your questions down ahead of time, so that you can feel empowered when you go into your appointment to really communicate openly, so that we don't feel embarrassed to ask about things or that we're wasting time, and we can just very clearly get across what we need so we get the best outcome. And I've just got some links here for further information. So there's the MS checklist that's on our website. The second one is called a question builder. And this is on the Health Direct website, which is an Australian government website about health. And there's an option to prepare for a GP appointment or a specialist appointment. And it actually takes you through a list of questions in asking you whether it's a new appointment or it's a follow-up. And then it has examples of questions that you might like to ask, and you can click which ones you want to be included. And then at the end, it auto-populates a little document that has each question and then some space underneath it to write down the answer. And you can either have that emailed, or you can print that out and take it with you. And there's some other options there as well, as our MS Connect number and email address, in case you wanted to contact us with any questions, or perhaps call and request to speak to one of the nurses. And I'll hand over to Annie.
Okay, great. Thank you very much, Jane. That was definitely a lot of information and a nice, concise way of presenting it. We've had a couple of comments being made. So I'll just go through those with you now, Jane. Leslie said that she's living in a regional area, and she's saying, no kidding about lack of choice. There are no MS neurologists. There's one general neuro an hour away, and she has one visit quarterly. So I imagine that's a common theme for many people who live in regional areas.
Absolutely, and I'm very aware of that. I do travel sometimes to some regional areas, and I'm very aware of how frustrating that can be. So it's even more important when you've got a general neurologist perhaps to prepare, because you might need to bring a bit more to the table in saying, look, I've still got this symptom, I believe it's related to MS. I've spoken to the MS nurse at at MS, and she's told me that this treatment came out 2 years ago, for example, and it's commonly used. I wonder if we could have a chat about that. So if you do think you might need a bit more help to get yourself prepared for your appointment, give us a call here and we can have a chat, so that we can figure out maybe the best things to work on. And we also do have a really great understanding of what neurologists are aware, so don't hesitate to get in touch with us if you would like to know about who's in your area or what your other options may be.
Okay, great. Thanks, Jane. Julie's written in to say, from her point of view, that it's crucial that someone else attends the appointment with the person living with MS. And in her situation, it's her husband who has MS. And she says that what he observes as his symptoms and relapses is often very different from what she observes. So she finds it important to attend the appointments alongside him, which is, I think, a good thing as well.
Absolutely. And often when we go to appointments where we might be our best self, you might be freshly showered and cleaned and in a nice outfit and you're on time and got your kind of formal speaking voice on and very polite. And so that is kind of the highlight reel, I say, of our life. And the neurologist might not be aware of what I call the behind the scenes, the fact that it took you 4 hours to get up and get dressed, or the fact that you often do stumble a little bit, or that you're exhausted by 11 a.m. So we do need to represent our daily life accurately, and sometimes it really helps to have someone else with us who can say, oh, actually you do struggle a little bit with that sometimes, or didn't you say you wanted to talk about this, or I've noticed that you're not finishing all your meals, just little things like that. So that's really really helpful. So thank you for making that point, Julie.
That's very important. Thanks, Jane. And Julie's also asked the question, does MS have a list of baseline questions that we can use as a basis to add our specific questions?
We do. So on our website, and that was on one of the previous slides, yes. If you search preparing for your neurologist appointment in our search bar, it'll take you to a link, and you can click on a document. It will open up in Microsoft Word. So you can either add more things to that on the computer and then print it out, or print it out yourself and write on it. Printers are very hard work sometimes. So if you don't have one at home, or you've got trouble with it, or the ink's run out, which always seems to happen to me, give us a call here and we can happily print a couple of them out and send them to you in the post, so that you've got them ready to go. And that has structure about what questions to ask, and place for you to write down the answers.
Great, thank you very much, Jane. Please feel free to type in any more questions that you have. We have got a few more minutes yet to go, so I might just move on and finish off with the final housekeeping slides. So just a word on the Get Your Act Together online tool. So that's there to help you manage your symptoms, and it focuses on the common symptoms such as emotions, fatigue, continence, cognition, pain and heat sensitivity. It's an interactive tool, so you can plug in all your information and it will generate a report that's specific to you. It was specifically made for those that are living in the ACT, so the information that you may receive will be ACT based as far as local services. However, other information is very useful and you're welcome to use that tool. It is on our website, and our website address is listed there on that slide. Okay, a word on the employment support services. So if you're struggling at work and you want to do better at your work and manage your symptoms better at work, and are struggling with that, you're welcome to call us here at MS Connect, and a referral will be made to the employment support service, and they will assist you to such things as disclosing your symptoms or disclosing your diagnosis to your boss, and managing your symptoms throughout the work day. And that number there is on the screen as well. The NDIS, we are a registered NDIS provider, And listed there on the screen is the services that we can provide in the various states. If you want more information around this, please call us at MS Connect, and you'll see that number listed everywhere. It is 1800 042 138. And just a word on the My Aged Care website. That's available for people who are 65 years or over. And if you access this website or call that number, you can get information, you can get assistance in mapping out your needs and an assessment for further supports. Okay, we've reached the end of the webinar. I'm just going to check and see if there are any more questions that have come through. And there's one here from Julie.
That's a really good question, Julie. So I think what we're asking you is, well, how often should I see my neurologist? Of course, I'm going to say it varies, but there are some general rules here. Usually yearly is a general standard. People would see a neurologist 12 monthly. Some people might have appointments that are closer together, such as 6 monthly. Some people with private neurologists might see them a bit more frequently. And certainly when people are newly diagnosed, they often will have a few appointments close together because there's a few things to organise, perhaps doing some tests, and then the next appointment might be confirming diagnosis. The next appointment might be discussing treatment options, and then the next one might be starting the treatment, which then needs a 6-month review of that treatment. So if there's something going on, we might have some closer appointments, but generally it's 12 monthly. There are a number of people that will stretch that out to every 2nd year because they're doing relatively well or don't need much input from the neurologist. And there's also some people that will only see their neurologist kind of as needed. You really do need to be getting benefit from the appointment to warrant you going and having ongoing appointments. It's a lot of effort to go, it's time, sometimes it's money, and it's a long way to travel for some people in regional areas for a doctor to say, no, everything's fine, I'm happy with how things are going. So we want to make sure that we are getting benefit, but at the same time, because things do change and new treatments become available or there's clinical trials, if you stop seeing the neurologist altogether and kind of just fall off kind of from doing that, you might miss out on something that would be beneficial for you. So if you are someone who's thinking, I don't really get much from this, should I stop going altogether? It might be worth being quite honest with the neurologist about that, or saying, actually, I'd love to see you every 2nd year for the moment because there's not much, I don't think there's much more for us to focus on. But at the same time, if you feel that you're not seeing the neurologist frequently enough, that's a good point to raise as well. And it might be that you need some more GP appointments in between, or maybe like a phone conference with the GP and the neurologist. And another little tip with the GP is have a think about routine appointments. It doesn't need to be every week. A lot of us wouldn't need that. Maybe you book one every 3 months, so it's already in the calendar, or every 4 months or 6 months, or maybe even more frequently, but it just means that it's already scheduled. So again, if you've got questions for the GP, you can write those down, and it means that you've got an appointment that suits you, because most of us have good GPs that you can't get into when you need to. So having an appointment booked in every 2 months can be quite helpful.
Okay, great. Thank you, Jane. Mark has written in and he's asking a question about some treatment. Do you know of any bad experiences with Ocrevus?
Ocrevus.
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 I beg your pardon.
Ocrevus is it's okay. Ocrevus is a disease-modifying therapy that is administered via infusion. To answer your questions, yes, I do. But I know of bad or negative or side effect reactions to all drugs. So that's not at all specific to Ocrevus, and I know plenty of good experiences that people have had. But if you want to have a chat a bit more about Ocrevus, perhaps send in an email to MS Connect and I can answer some of your questions directly, or we can have a chat about that further.
Okay, great. Thanks, Jane. All right, if there's no more questions, Leslie's just typed in saying that she's doing great on Ocrevus.
Oh, thank you, Leslie. I'm glad to hear that.
Yeah, good on you, Leslie. All right, and Marianne's written in to say, thank you, Jane. It was extremely informative session. And she's also saying, yep, me too. So she's doing great on that medication. Lou has written in, thank you for this morning's presentation, very informative. Okay, great. So if there's no further questions, we will close. But before we do, thank you very much, Jane, for joining us today and providing the information this morning. And thank you everyone for joining us out there. It's lovely to have you on board. We will ask you if you wouldn't mind staying on a few minutes after we've closed the webinar. A survey will pop up on your screen. If you can spend a few minutes and just let us know how we went today and give us your feedback, that would be very much appreciated. Okay, so if there's no further questions, we've got people saying thanks. So thank you to Jane, that's wonderful. Danny and Leslie also saying thanks. All right, so we'll close for now. Thank you everyone for joining us. Enjoy your day and we hope to see you online soon. Bye for now.